Annual Bloodborne Pathogen Training. Welcome. This is presented by your friendly Student Health Center staff. What are bloodborne pathogens? Microorganisms such as viruses or bacteria that are carried in blood and can cause disease in people. What kind of diseases? Well, there are many different bloodborne diseases. We will focus on the three most severe and life-threatening. First, hepatitis C, or HCV. Hepatitis B, HBV. Human immunodeficiency virus, HIV. Danger. HIV and hepatitis B are caused by a virus. A virus, what is it? A very small germ that is invisible. Knock, knock. Go into your body. Contact between mucous membranes, eyes or mouth, and infected body fluids. Sexual contact. Sharing of needles from mothers to their babies at or before birth. Accidental puncture from contaminated needles, broken glass, or other sharps. Let's talk about hepatitis B. Hepatitis B, or HBV, the virus that causes hepatitis B, is very durable. It can live in dried blood for up to 7 days. Hepatitis B is a virus that infects the liver. Some people carry the virus and never get sick. Others who are infected with the virus develop only mild problems. Some people who contract the disease will develop antibodies which help them get over the infection and protect them from getting it again. Signs and symptoms of HBV. Muscle and joint aches, headache, fatigue and weakness, abdominal pain and tenderness, nausea and or vomiting, mild fever, jaundice. There is not a cure for hepatitis B, but there are vaccines to help prevent it. Hepatitis B vaccine. It's a series of 3 injections into your upper arm. It's done over a period of 6 months. Hepatitis C is also caused by a virus. The virus hepatitis C is also called HCV. It is referred to as the silent epidemic, one of the most common causes of long-lasting liver disease and liver transplants in the U.S. today. Symptoms may not appear until 10 to 20 years past exposure. There is no vaccine and no apparent cure. The symptoms of hepatitis C are similar to flu symptoms: feeling tired, feeling sick to your stomach, poor appetite, stomach pain, diarrhea, muscle and joint pain, dark yellow urine, and yellowish eyes and skin. Let's talk about HIV. It is the human immunodeficiency virus, or HIV. This virus attacks the body's ability to protect itself against disease. It is extremely dangerous. A person infected with HIV may show no signs of having it for years. Eventually, most people with HIV develop AIDS, acquired immune deficiency syndrome. People with AIDS develop diseases such as pneumonia, skin cancer, problems with the nerves, and other infections. Most die from secondary infection. How are these germs passed around? Do not enter. Bloodborne pathogens can enter the body by a sharp object that is contaminated by the virus when it cuts or punctures your skin. Examples: needles, broken glass, knives, etc. A contaminated object touching inflamed skin, acne, or skin abrasions. Touching a contaminated surface and then touching your eyes, nose, mouth, or open wounds, or inflamed skin. These viruses are also transmitted by sexual contact with an infected person, sharing needles with an infected person, an infected mother to her baby at or before birth. Am I at risk of exposure? There are specific job classifications that have a higher risk of being exposed to potentially infected body fluids, and those are medical staff, housekeeping staff, coaches, residential staff. But all of us have a potential for coming in contact with blood and/or other body fluids. So therefore, we all need to pay attention and protect ourselves, not only in our workplace, but also out in the general public. How to reduce your risk of exposure? Have an exposure control plan. What is it? It is a set of actions you can follow to reduce your risk of being infected and what to do if you are exposed. Where is it located? The Health Center has a copy of the plan. There is also a copy located in HR. Universal precautions. All blood and body fluids are treated as a possible source of contamination and infection. All, not some. Universal precautions. If it is wet and if it is not your body fluid, don't touch it. How do I use universal precautions? By using your personal protective equipment. Say what? Personal protective equipment is special equipment provided by the Student Health Center to protect you against bloodborne pathogens and other infectious materials. But you have to use it to be protected. What kind of equipment? Gloves, latex or non-latex, mask and/or face shields, gowns and aprons, biohazard bags. Where do I get that stuff? Your friendly Student Health Center provides this equipment for you. It is your responsibility to ask for replacements of PPE when it is used. How do I use it? Always wear personal protective equipment in exposure situations. Remove PPE that is torn or punctured or has lost its ability to function as a barrier to bloodborne pathogens. Replace PPE that is torn or punctured. Remove PPE before leaving the work area. Remember to use universal precautions and treat all blood or potentially infectious body fluids as if they are contaminated. Avoid contact whenever possible, and whenever it's not, wear personal protective equipment. What else can I do? Wash your hands. The most important and easiest method used to prevent transmission of bloodborne pathogens. Hands or other exposed skin should be thoroughly washed as soon as possible following an exposure incident. Use soft antibacterial soap if possible. If not available, use antibacterial wipes or solution. Wash my hands? Yes. Wet your hand with water. Apply soap. Lather by rubbing hands vigorously for 10 seconds. But I washed them this morning. You should always wash your hands at the start of your day, at the end of your day, before meals, before and after toileting, after blowing or wiping the nose, eyes, or mouth, after handling anything potentially contaminated, after removing your glove. Good housekeeping. Good housekeeping is another important way to reduce your risk of having contact with potentially infected body fluids. It helps protect you and your student. Okay, so what do I do? Clean contaminated equipment and/or surfaces as soon as possible. Our housekeeping staff has a disinfectant spray that can be used. If that is not available, you can use a 1/4 cup of bleach per 1 gallon of water as a decontaminant. Never clean up broken glass with your hands. Use a dustpan and broom, brush, cardboard, or tongs. Do not use vacuum cleaners. Broken glass should be put in a sharps container and not in a plastic bag. Always wear gloves when handling dirty laundry. Put contaminated laundry in a plastic bag that prevents leakage. Never mix dirty laundry with clean laundry. Have separate carts labeled clean laundry and dirty laundry. Always wear gloves when handling trash or cleaning bathrooms. Never, never, if you are working in an area where there is reasonable likelihood of exposure, you should never eat, drink, apply cosmetics, or handle contact lenses. I've been exposed. If you come into contact with any blood or body fluids, immediately wash the area with soap and water. Report the incident to your supervisor. The incident will be reported to HR, and the type of exposure will determine the actions to be taken. Remember, you are your best line of defense. You must use your PPE, follow universal precautions, and do good housekeeping to protect yourself and others.